Assalamu alaikum. Welcome to Let's Talk. I am Dr. Anita Raja. And like every Monday evening, we have a very, very interesting topic that we're going to discuss today. Our topic of discussion today is body dysmorphia and the pressures of social media on our self-image and our body image. Now, if we look at social media, unfortunately, the world has become a global village, which is a nice thing, but yet a bad thing as well at times, because it puts us under immense pressure when it comes to the way we should look. And essentially, this pressure can affect our mental health. Now, when we look at our youth, the teenagers that are coming through universities and colleges, following all these amazing YouTubers, Instagrammers, all these amazing celebrities, the expectation is that they also want to look perfect. Now, what we tend to forget is that behind all these perfect pictures, these beautiful Instagram posts and Facebook posts, is a lot of effort in terms of the nutritionists that are behind them, in terms of the cooks, the chefs that prepare their meals, in terms of the makeup artists that do the amazing makeup, the personal trainers. There are thousands and hundreds of dollars and pounds that are pumped behind these Instagram posts, these Facebook posts. Yet we try to achieve the unachievable. There's a quest of trying to become this perfect person. And of course, sometimes it can be extremely overwhelming. Another thing that has come to light is that if we feel that we are imperfect in any way, then sometimes we try to correct that imperfection. And sometimes that imperfection is something that only we can see and others cannot, because it is so minute that it is hardly visible. Yet people try to perfect themselves. They resort to cosmetic surgeries, to resort to doing extreme things that sometimes can result in them becoming botched. Now, there is a lot of debate on the internet at the moment, if you look at social media. And of course, there is a lot of awareness that's coming through as well. When I was much younger, we did have the internet, but it was fairly new. And yes, it was very exciting to be part of this amazing global village where everybody's connected and everybody can talk to one another via the messenger that we used to have at that time. But still, there was some limitation to the way we could be connected to others. But now, you will be in bed and it's 24/7, it's in your face. And sometimes it's so difficult to be able to disconnect to this. Now, with 6 billion people, more than that, I think it's 7.67 billion people in the world, so many ethnicities, so many skin colors, how in the world will we be able to set this one standard of beauty? To discuss this and much more, we have invited on our show Dr. Hina. Dr. Hina, welcome. How are you?
Hi, girl. Yes, I'm great, Anita. How are you?
I'm really well. So my first question is that I would like you to tell our viewers what body dysmorphia is.
Okay, so body dysmorphia is basically one's preoccupation of a perceived flaw or defect in their physical appearance, which isn't necessarily seen by anyone else.
And do you think that social media in today's world would exacerbate this issue if you're already suffering with lack of self-esteem?
Definitely. I think social media is a huge cause as to why we do have, our self-esteem it basically is affected by it. In the States, there was a recent.
Yes, and Dr. Hina, there was also this issue that was raised a couple of years ago where there was this whole campaign that, because of social media, I mean, we put people on Instagram, we put people on Facebook, and they look just so perfect. Yet there is little authenticity behind these pictures because we don't know how much they're tweaked. And there's a lot of debate that there should be, if somebody is actually tweaking their pictures, airbrushing them, editing them, they should actually acknowledge that. What would you say to that?
Definitely, because what it's doing is portraying an unrealistic image, and it's portraying, reality in a way that isn't true. So actually, what you are seeing, what younger girls are seeing, whether it be regarding products that are being used. So the campaign that I think you were recently talking about is the Filter Drop campaign by Sasha Blari, and it's a huge moment because actually it's bringing clarity to social media. So particularly for younger generation who are affected by it, who are in that developing age where they are constantly looking at themselves and where society has constantly pressured in a way to be so self-conscious about it, about their looks and about how we are portrayed, as well as what actually goes out on social media.
And Dr. Anna, do you think that there is a lot of emphasis on the way you look, sadly, rather than who you are? I mean, if you look at different people from different age groups, there's a lot of emphasis on looking beautiful somehow, and that is associated with a woman more than a man for some odd reason. I mean, there's a lot of history to this as well, but how long will we be able to put up with this pressure?
Unfortunately, I'm not really sure, but we have seen quite a steady rise since 2005, I would say, and that's kind of when social media and was able to be accessible via phones. So since then, we've seen the huge impact it's had, particularly in documentaries like The Social Dilemma that came out around a year ago, and it stated how, and it showed how teen suicide was on an increase of about 150% in the States. But the main leading cause of it was due to people's their self-image and the idea that they had built up in their head because of what social media is always portraying how we should look, how, not so much as to how we should behave, but it's more like when you go out for your grocery run, you need to look good. When you go for school run to pick up your kid at 5 p.m., 6 p.m. after work, you still need to look good. And it's all that pressure of having to constantly focus on your outer appearance rather than actually your inner appearance or your inner self.
And also in terms of sort of editing pictures, now when you look at social media, for instance, if you go on Instagram, Snapchat, there's so many filters out there. It becomes impossible for you to be able to put up with a picture of yourself without that filter. I mean, I want to talk for myself. I'd rather have that filter than have a picture without a filter. I mean, I would want to be that perfect person who accepts themselves the way they are, but sometimes it just gets so tempting and so difficult to do that. I mean, what can we do to combat this? Because it certainly seems like a pandemic.
Yeah, the pun, I picked that up on that. Definitely, and it's really hard actually to break out from it. I wouldn't say there are many people who are very comfortable in their own skin, but a lot of this is due to what society has fed us. So in the era that we are currently living in, it's very much about, being slim or being either fair or tan, depending on which part of the world you are in. But it's also about, just looking good generally. And I think weight is a huge issue. But if you look back to kind of like the Renaissance period, it wasn't like that. So it's very much affected really by our society and our culture. And I think as a society, we need to change, really. It's more about bringing in, having really strong figures around you, and particularly for young girls who are growing up. So their brothers, their uncles, I think particularly for me, it was really important to have those type of figures around me to constantly remind me that I'm not pretty just because I'm wearing makeup. Naturally, you are pretty in whatever you are, and how you look, and everything else, they are happy to accept. But I think it's having those strong figures, whether they're male or female, teaching young girls, and obviously also teaching of awareness of what the photos go through on that actually are put on social media.
But how does society help us then? Because if you come to think of it, if you are, for instance, in the South Asian community, when a baby is born, there's a certain expectation that the baby needs to look a certain way. Now, I've had two boys, and every time I've had my guests who've come to see the babies, there has been a lot of discussion of who the baby resembles, who the baby looks like. And sometimes that can have a detrimental effect on the mother's mental health as well, because you would agree that a mother definitely wants her baby to look like them rather than the dad, because she's put in all the effort. And, sometimes, you really don't want that commentary, but it doesn't stop. It sort of starts right after birth, where, people want to see that perfect child with the perfect features. What should we do about it?
I think it's, again, raising awareness. That's why it's constantly so important to be talking with friends, and it's not necessarily pointing people out, but having that open conversation. So, for example, if someone, and it's hard, right? It's hard to change that because it's not ingrained in just young generation. It's not, when you see a friend, the first thing she probably doesn't say is, "Oh, you greeted me really well." It's more like, "Oh, you look so pretty." The first thing as women we focus on is also about outer appearance and looks and everything. And I guess we need to, being in such, I have a son, and we're in such important positions to actually help the next generation to be aware that looks aren't important. And as a society, for us to have these conversations either with whoever is having, so like you said about where people are coming to you, maybe not at that moment, but then maybe later on having that conversation and saying, I don't think that is actually helpful, or I don't think that is probably how the most important thing. I hope he takes maybe, my brain in the knowledge that I have, or, I hope he takes this rather than the appearance type, if you get what I mean.
Right. Now we're going to continue our conversation. If you want to be part of this show, our number is on your screens. Dial in and be part of the show. It's time for a break. Welcome back to Let's Talk. We are talking about body dysmorphia and the curse of airbrushing, the pressure that social media puts us these days, because it somehow defines beauty. The big question is, who is going to define beauty and who will set the standards? Is it going to be a social media personnel? Is it going to be a celebrity? Is it going to be people from our society, our culture, or is it going to be us? So to discuss this, we have invited Dr. Hina, who was with us before we went on to the break. And we were talking about the pressure that a child is put under, especially from the time that they're born, because in different cultures, there's this different set standard of what beauty should be or should look like. But Hina, do you agree that now when we look at beauty, somehow, the thing that I fail to understand is, we've got so many cultures, so many ethnicities, yet when we look at social media now, we realize that the body needs to be a certain way, that the lips need to be a certain way. And somehow it seems that they're trying to set this standard. I don't know who they are, but they out there somewhere are trying to set this standard. And sometimes this quest gets overbearing.
Hello? Sorry, I just...
So sometimes this quest gets overbearing. Can you hear me, Dr. Hina?
Yes, definitely. Yeah,
yes,
just
yes.
laughed at.
So what would you say to that?
It is tough. There is obviously because of social media. So previously, what I would say is prior to 2005, which is when we were able to access through the mobile magazines and stuff or in pictures that would normally just be in magazines. So now what's happened is we're able to access these photos, we're able to access the advertisements on our phones, which are constantly with us, and it's now becoming kind of like a universal everyone has the same access. There's no kind of a variation from almost culture to culture or countries, because everyone is constantly looking at the same image and they're considering the same image to be the beauty standard.
Yeah. And also, you know, when we look at the advertising, the UK's Advertising Standards Authority, there was a ruling that came across where they were actually discouraging influencers to use filters because they thought that, you know, the sort of image that they're portraying and the sort of image that they're encouraging isn't the real image and isn't achievable. Do you think we need more in place in terms of legislation?
Yes, definitely, because actually what that legislation came through was specifically towards just influencers and products that were being sold, so campaigns and advertisements. But I do think even, you know, what do we classify as who is an influencer? Because people who will have maybe a following of 3,000 people, or people who have a following of 50,000 people, you know, are both considered as influencers. So like that, we have a lot of micro influencers, and these micro influencers could be, you know, could be your best friend, could be someone within your neighbor. And it's not just the influencers, but it's also, you know, it affects us and what we are portraying. In a way, even though we may not go out to try to be influencers, you are essentially affecting the people around you. And, you know, it should also be, I think the legislation really should apply to in a general public way as well.
And also being a parent in today's time and age, when you see your children trying to achieve this, their perfect self, trying to look perfect and emphasizing on being beautiful more than anything must be overbearing. I mean, Hina, your child is very young. My children are still very young, not in that age where they probably know much about looking good. However, it does put parents in a very tricky situation. I mean, being a general practitioner, have you ever come across parents who are actually struggling to support their children?
Definitely. I mean, there have been lots of times where I've had, you know, young teenage girls coming to me because of either having body dysmorphia. So, you know, there are other medical conditions that can lead from body dysmorphia, such as anorexia, bulimia. But I've also had other people who've come to me on a daily basis. You know, people are very, very concerned about their skin appearance. So even just the smallest pimple will, you know, they don't realize that actually at a certain point in their life, some of variation in skin is normal. So they will really want to go for the most extreme treatment, which does not, you know, the pros and cons of that treatment is not justifiable, but because they are so concerned about, you know, their looks and making sure that their friends don't see it, or making sure it doesn't, they are portraying this really perfect kind of appearance that, you know, they have obviously in their mind, then it becomes quite difficult as a GP, really, because sometimes you have to have that conversation that actually this is normal. This is a bit of, it is normal going through your teenage years, changes in hormones. But yeah, you do see a lot of that in GP.
And in terms of social media detox, like if you feel that someone is actually suffering from a lot of anxiety, depression, and, you know, trying to keep up with all these very overbearing social media posts, is social detox something that could help? Or, you know, is this something that you have advised your patients?
Definitely, I think it's something that everyone should do. There is different forms of social detox. Obviously, you know, some people will go away for a month. Some will, you know, take a break for a week. Some people will limit the hours. So what I tend to do is I limit the amount of time I'm actually on social media, and that will include particularly Instagram and Facebook. Just to kind of make sure that I am not mindlessly, in a way, just scrolling through. And I think that's the real danger, is where it's not so much what we do consciously, but subconsciously, oh, I'm just bored, or oh, I'm waiting for a friend, let me just check what's happening on Instagram. And we don't realize that on a subconscious level, that is actually really affecting us, because, you know, you see someone having a great time, and you may be stuck on a bus stop, and then that might affect how you are feeling about being stuck on a bus stop. So it subconsciously does affect us, even if we are mindless and just scrolling. So I do tend to, my personal self, my siblings, my husband, everyone in my social circle, we probably don't use social media as much as a younger generation. I'm still, I would say, a bit of the older generation, but we obviously have to because of work or just how we are connected with people and friends from different parts of the world. But we still try to limit it and make sure that we are not actually putting ourselves in a position where we are going to be influenced by it on such a regular basis.
It is very important. I mean, yes, you need to sort of take a break from social media and all the toxicity around it, I guess. But also another thing that has come to light is that social media does not only aggravate your body dysmorphia and affect your self-image, anxiety, and depression, but sometimes can put our teenagers, our youngsters under immense pressure, leading to eating disorders. Now, that is another thing that comes with the pressure of looking perfect and slim, because unfortunately, we are now in an era when the skinnier, the better. I mean, what sort of support is actually available out there for children or young people who suffer from poor self-body image and suffer from sort of eating disorders?
I think the first thing is obviously to contact your GP. If you know someone or you yourself, there are obviously helplines for people who have already diagnosed eating disorders. But if you are in that kind of gray area where it's not yet been diagnosed, which tends to happen a lot more, I would contact your GP, have a conversation with them, and they will be able to point you in the right direction in getting help. And that could be nutritional support, it could be help with the mental health team, as well as just other groups around your area where you can be in contact with people who've gone through similar, so like peer groups where people have gone through similar times and had to deal with the difficulty of accepting it and also finding treatment for it, and then also trying to prevent it. One of the problems with eating disorders is people can have relapses, so it's really important to have also that strong network of not just family and friends, but people who you can really talk to and who you can look to for guidance and support in that particular field.
And also, when we look at the sort of younger generation, unfortunately, we do see that, yes, there's anxiety, depression, and the pressure, but it's very difficult to break free from this cycle. I mean, there's a lot of sort of self-help out there as well, where there's a lot of encouragement of sort of picking up a hobby, meditation, yoga, enjoying nature. But unfortunately, I mean, I think I'm criminal as well when it comes to this. When we go out to a destination, the emphasis is more on taking that perfect picture than enjoying that moment in time. I mean, have you ever done the same, Hannah? You can be honest if you have.
No, I mean, definitely. I'd be lying to say if I don't do that. But, I think, again, it's having... I guess I'm lucky. My husband is not very much into social media at all, so he does keep me into check. But it is, having those people around you, but also being aware of it. I think the biggest thing is to know consciously what you are doing. So knowing that, if you are spending 5 minutes trying to get the perfect selfie, you've actually taken 5 minutes away from the moment that you are in. So, in the olden days, it was kind of like, with our parents, it was to really capture the memory. So I quite like film photography for that particular reason, because you can't take 100 snaps and you can't actually revise it immediately. And actually, but you're still capturing the moment, right? So you capture whatever moment was there, and you'll find out 2 weeks later after you get the film developed. But, you have to remember that you have to be there in the present. And what you were talking about being mindful, like, so mindfulness is really important in this, but you don't have to go through a mindfulness course to actually, be present and try to really enjoy the moment. I mean, what is the point of going on a holiday if you're going to spend so much of the time actually just worrying about how you look for that perfect photograph,
No, you're absolutely right. Dr. Henna, thank you so much for taking our time today. And I'm going to remember your golden words on my next holiday. I'm definitely going to try and live in the moment and spend less time on taking that perfect picture that needs to go on social media. Thank you so much for coming on our show. Viewers, we're going to continue this conversation because it is so interesting. If you want to be part of this, our number is on your screen. You can WhatsApp us, you can call us. And this is time for a break. Welcome back to Let's Talk. I'm Dr. Anita Raja. Before we went on to the break, we were talking about body dysmorphia and the curse of photo editing, airbrushing, and the pressure it puts us under because we are constantly striving to look perfect. The quest of attaining that beauty, which becomes unattainable at times, can be very overbearing. We will continue our conversation, and we need to ask ourselves this question: do we really need to look perfect? To answer this question, we have invited Dr. Yusra Atia. Dr. Yusra, welcome to our show. Assalamu alaikum. We're very pleased to have you on.
Thank you very much for having me, Anita.
So we're asking a beautiful woman whether it's important to be beautiful or not. So this is going to be an unfair answer, isn't it? So
I wasn't expecting that compliment, but thank you. Do we need to look perfect? I think define perfect. If you ask me what I think is my definition of perfect, might not necessarily be your definition of perfect or somebody else's definition of perfect. And I think that is where the issue is here, because we're always striving to be perfect, but no one actually knows what perfect is. Do you get what I mean?
100%. And I think that the question in today's show is, when we are striving to look beautiful and perfect, what are we trying to achieve? Is it a definition that has been defined by our culture, our community? Is it our celebrities? Who is going to tell us who this perfect person is? And you see, the question is, when are we going to draw a line and stop and say, okay, fine, we feel well enough, we feel good enough, we feel presentable? That is the main question. And you do a lot of aesthetic work. So do you actually ever get people who come to you and say, doctor, we want to look like this certain celebrity? Does that ever happen?
Oh gosh, all the time. And I find it, at the start, it was quite difficult because you want to have that patient satisfaction there and you want to do your job right by the patient. But as much as I do aesthetics, I'm also a doctor. I'm a general practitioner, and when I finished my training, became a doctor, we had to put our hands up and do the oath and say that we have a duty of care to our patients. And regardless whether I work in the NHS or I work in an aesthetic clinic, I have a duty of care by my patients. And it was really, really interesting when you just said, are we well enough? Because I think that really is the forefront of it all. It's not about what we look like, because like I said, what my idea of perfect isn't going to be what your idea of perfect. What my idea of attractive isn't going to be what your idea of attractive is. But it's about being well enough to accept what you look like, because beauty's in the eye of the beholder, isn't it? It's about being confident. And I think and I use this in my practice all the time, and I say beauty is confidence. It's having the confidence to be comfortable in your own skin. And it's a shame that social media, and not just social media, the internet, the media, the tabloids, everything around us, especially since we've gone so digital, following COVID and everything else, all we see are these photos of beautiful women and everything's just perfect. But then you mentioned before, you've got makeup, you've got all sorts in the background, you've got editing, you've got aesthetic treatments, you've got surgical treatments, you've got a lot of hard work on behalf of that celebrity or that influencer that you don't see. You just see the snapshot image of them looking confident and glowing, and that's all from within. But for me, in my work, and I see this in the NHS side of things as well, it all boils down to your own mental health and it's your own journey. And it's not always aesthetic treatments. It's not always having the perfect skin. It's not always having the best clothes or the best body or anything like that. It's just about being comfortable.
And does that start at a very young age, you think? Do you think this confidence starts at a very young age? And is it influenced by people around us? For instance, our parents, our peers, our aunties, our uncles who are visiting and perhaps commenting on the way we look without them even realizing how that is affecting us?
It's really sad. But yes. I actually was speaking to a client recently, and she was telling me how she didn't feel attractive and she didn't feel like she was herself, and it stemmed because when she was younger, all the way through her childhood, she was told that she had dark skin and she was the darkest, and that has stuck with her despite the fact that she's beautiful, she's gorgeous, but she's got that in the back of her head. I'm not good enough because I'm not like all these other people, and that's really, really sad. And so my answer is yes, we have to be so careful of what we say to our children, what we say to our friends, what we say to even people who are older than us or peers, because words stick. And especially if it's something that you might not think is a sensitive topic for you, you can say something to someone else and that can really, really harm them, both mentally, but it can actually trigger them to go and seek out treatment that they might not even need. So yeah, it's sad, but it's true, and it's still very valid in this day and age.
Yeah, and it's just incredibly sad. You're absolutely right, because we're breeding these kids and we are not giving them the confidence that they need. I mean, I've got a very, very lovely close friend. Her name is Nisha. She's a doctor as well. And we talk about everything. And she mentioned something which really stuck with me. And I want to mention this on the show because this is a lesson for all parents. So she said, she's beautiful, she is, but she said that in her household, when they were little, nobody ever talked about how anybody looks. Never. It was always about how kind somebody is, how smart someone is, how intelligent someone is, how funny someone is. So it was never about how somebody looks. That was a topic that never came up. She's 30 now, and in 30 years of her life, the parents have actually managed, despite being South Asian, not mentioning beauty. How important is it being a parent?
I mean, hello. Oh,
yes.
I mean, I don't think beauty or the way we look should be a taboo. I think we should talk about it to an extent. Certainly not individually. We need to talk about how our differences are beautiful. How the fact that each and every single one of us has different skin color, has different characteristics. And you asked me about whether I get anybody bringing in photos and saying, I want to look like that. And yes, but I would never, ever say, yeah, let's make you look like that, because it's about embracing the beauty of yourself. And I think talking to your children about how beautiful their skin is, how beautiful their hair is, how beautiful they are, is so, so, so important, because they will grow up believing that. And I mean, I'm from an Arab background. I'm Egyptian. My whole family is Egyptian. I've lived in Egypt. I've grown up in Egypt, and it is very valid. It's exactly the same. Comments are being thrown about, and I used to get scared about going back home to Egypt, because I thought, oh, if I put on weight, they're going to comment about me putting on weight. And it was only in my late 20s that I was like, oh, so what? And it took a lot for me to learn that. And that's something that I think we really need to instill into our children.
Definitely. And I think it's that is our responsibility, especially if you are the mother to a boy. This is the first step you need to take, because you want your daughter-in-law to feel perfect and beautiful and confident, and you should not be judging women by their skin color, by the way they look. Do you get any requests around skin whitening at all? Is that something that comes across in your practice?
Yes, and even worse, I get a lot of people who've gone down the skin whitening route kind of by themselves. Usually quite like Backstreet, you can buy anything off the internet nowadays. And they've read up about it and decided to go and purchase it and try it out, because an auntie or a friend has said, oh, this ingredient's fantastic and it works. And they don't realize the risks until it's too late. And they don't know the dangers. And they're the really hard conversations to have. I will happily turn people away, but it's about having that conversation of, you shouldn't have done that. I wish you had that education there that could have guided you, because now, for example, you can end up with a lot of these.
Definitely, Yusra. It's a very difficult conversation, but I think because you've taken that oath and you're a doctor, you're a medic, and maybe other healthcare professionals also take it more responsibly. But if you are in the aesthetics business and you're not aware of these things, then that can be difficult. We're going to continue this conversation, of course. Time for a break. If you want to be part of our show, you can call us, you can WhatsApp us. Stay with us. Welcome back to Let's Talk. Before we went on to the break, we were having this interesting conversation with Dr. Atia, who was telling us about skin whitening solutions. So people are actually going onto the internet, buying these products, using them, and they have absolutely no idea how detrimental these can be to their health. And I'm very keen that we recommence this conversation. So Dr. Yusra Atia, before we went on to the break, you were telling us about the skin whitening products that you can buy. I mean, I've heard about these injections as well, actually, that you can purchase now very freely and widely over the internet. Tell us about them.
I'm just going to pause and say, yes, skin whitening is a problem, but skin tanning is also a very, very, very big problem. And you can get pills and injections and all sorts over the internet to make you look darker. And that's going down back to what different cultures, different people, different upbringings find attractive. But for skin whitening in particular, a really common ingredient that's used is something called hydroquinone. Hydroquinone is used safely by doctors and by dermatologists and by aestheticians to treat skin. The issue here being is when bought over the internet or on the black market or God knows where, these can sometimes be mixed with steroids. They can even have ingredients that aren't listed on the label. And what happens is these poor women and men are left with something called rebound hyperpigmentation, which is notoriously difficult to treat, and is like a grey, sometimes purpley discoloration from over treating. And when we lighten our skin, we want to stop the melanin, which is what pigments the skin. So we want that cells to stop being active. And what happens is, because we do that medically very, very safely, very slowly, we monitor it, we make sure that you use the right ingredients with it. Unfortunately, if that's not done correctly, you shut down all your melanin, and then when you stop using the product, you get what's called an overexcitation of that melanin pigment, and you get what's called rebound hyperpigmentation. And I've seen people with this treatment, and it's hard to treat. It's near enough impossible to treat, really. And they don't know that. They get told that if you use these injections, IV infusions is another one. You can even get IV infusions that can help even skin tone or lighten skin tone. And yes, they are readily available. You can go to a medically qualified person and be safe in doing that, because they'll be able to treat you accordingly based on your medical history, based on your risk factors. They'll prep your skin accordingly. But when people are so desperate to get that aesthetic result, you don't think of all those risks, because you look at it with rose-tinted glasses that I'm going to be beautiful at the end of this. And that's really, really scary.
Yeah, but also, there is a lack of legislation in this country. I mean, if you come to think of it, anyone can just pick up an injection and inject you with Botox fillers. Anybody can just pick up, a drip and just give you a drip. It is something that needs to be regularized. I mean, we need a proper legislation around it. This is exactly what I was saying before we went on to the break. Yes, you probably sit down, and I'm sure all of my colleagues, the doctors and nurses around us, are actually sitting down, speaking to their patients, saying, look, hold on a second, this is not right for you. But what about all these other people who have these, who are estheticians, and they call themselves that, and they're doing your job for maybe quarter the price, and leaving people botched?
I can go on about this, Anita, for a very, very long time, but I'm not going to. It's unregulated, and it's embarrassing, because we're pretty much the only country that is so unregulated when it comes down to aesthetic procedures. And yep, you can buy filler over the internet, you can buy Botox from over the internet, you can buy anything, and there is no repercussions for these people, because it's legal. And they certainly don't have a regulating body that they have to answer to like me and you do. They don't. So there's nothing really that stops them, but you can't completely blame them. It's legal. They're not technically doing anything wrong. But very recently, it has been legalized that under 18s cannot have aesthetic procedures. That was the given before. That was the right thing to do before, but now it has been legalized. So I feel like the more we shout out about it, the more we talk about it, things are very slowly, but they are hopefully going to go in the right direction.
And Yusra, before we went on to the break, we talked about how diverse the definition of beauty is and how it varies from person to person, from culture to culture. I mean, I'm sure you have lots and lots of people who come to you from different ethnicities. You're Arab yourself. You're married to someone from Pakistan, so I'm sure you deal with lots of South Asians as well. So, what form of request do you get from the Arab and South Asian community? I mean, what are they trying to improve about themselves?
It's really fascinating, actually. Again, it goes back to what you feel is beautiful. But for example, Arab women, they like the big cheeks. They like to look full. The Western look at the moment is the chiseled cheekbones and the heart-shaped face and the big lips, whereas it differs so much. But what's really, really refreshing to see, so I've been practicing aesthetics for about 4 years now, and what's really refreshing to see is I've had a lot more South Asian women come forward and not just want to look different. They want to look natural. They want to look like themselves, but better. And I think that's all down to normalizing aesthetic treatments, because it's not about changing your features. It's about giving you the confidence. It's about giving you that, making you more comfortable in your own skin. And I also find a lot of people coming down, and skin is a big thing at the moment. Having healthy skin, perfect skin, even skin, and there's been a lot more kind of injectable skincare treatments, and I find a lot of the time it is, I want to look amazing, but I don't want anyone to know. And there's a skill in that, I think. But it's so refreshing from my end to see South Asian, Arab, cultured women looking after themselves. Because you saying to me that you want to look refreshed, but you don't want anyone to know, tells me that you're doing this for you. And that's really nice. That I like that part of my job.
Yeah, you look like you do. I think you really enjoy it. You do enjoy this,
I love
don't
it.
you?
I absolutely love it. I aesthetics for me it's not about looking different. It's not about that at all. And I think this is the big taboo. And I know when I first started it, my dad looked at me. My dad's a doctor himself. He looked at me and he was like, I'm not sure about this. What do you mean you're going to be injecting and doing lips and you're going to have big, massive lips and all this? But when I show him some of my work, and he now understands that it's a very holistic, just like any medicine should be. It's very holistic. It's about looking after the patient's mind. It's about looking after the patient's outcome. But it's also about the aftercare and everything with it. And I would never, so you were speaking with Dr. Hina about body dysmorphia before, and I was listening in, and I find that really, really interesting. And in every consultation that I do before we do any treatment, before we even do the medical consultation, I go through what we call BDD, which is body dysmorphia questionnaire. And they're strange questions. They're not kind of your everyday questions. So it does take a lot of people back. But it's so important that I think we have a duty of care as practitioners, but also as family members and as mums and sisters and brothers. I think the males have a big impact in this as well, to if we feel like someone is suffering mentally from their way that they look, it's really important that we are able to, number one, acknowledge that, and number two, be able to signpost them. If we can't do anything about it, signpost them and maybe highlight it. And certainly as aesthetic practitioners, we shouldn't be treating them at all. And I have turned a lot of people away that fit into that criteria of, look, I'm not here to diagnose you, but I don't think going ahead with this treatment is in your best interests. And I'm not gonna lie, I've not had some people have been not very happy with that outcome, and 2 weeks later they've gone and had the treatment regardless, but I can sleep better at night.
That's right. And Dr. Yusra, that makes your work so much more better. I'm so pleased that you're one of them who do this responsibly. Thank you so much for being part of our show. Unfortunately, we're out of time. We'll catch you again, viewers. Bye.